Evening, and thank you for coming to this session. So tonight we are going to start with understanding the causes of diarrhea and the different type of diarrhea and what remedies and what you can do to help yourself. So please, if you have any question, put it onto the chat as you go along so that you can remember.
Okay, good evening, everyone. Tonight's topic is dealing with diarrhea. In diarrhea, because diarrhea is a very common problem for all of us, but in some cases, it actually, especially for a vulnerable group like children, it could be a life-threatening issue on diarrhea. Now, diarrhea cover both acute and chronic diarrhea, and basically the causes of diarrhea are numerous. Just remember a simple principle. There's no one size-fits-all solution for diarrhea, right? In fact, if you can diagnose your diarrhea and identify the cause of diarrhea itself, very often there is a specific remedy that can help you with the diarrhea itself. Now, let's start with what is the definition of diarrhea. Diarrhea means actually passing loose or watery stool more than 3 times per day. And you can sort of further divided into 3 subclass. Acute diarrhea basically is usually lasts 1 to 2 days. It's a very short, but the flare-up is very fast. Symptoms are quite severe in comparison. Right? Then persistent diarrhea basically is diarrhea that lasts 2 to 4 weeks. And chronic diarrhea usually lasts more than 4 weeks. For diarrhea, what is the main risk? The main risk basically is dehydration and nutrient loss. Right? So dehydration is the main risk for acute diarrhea because it can lead to complication and life-threatening situation. Whereas the main risk for chronic diarrhea basically is nutrient loss. You will actually resulting in loss of quality. Okay, now let's look at some of the means about diarrhea. So when you have a diarrhea, very often you will hear some of the people tell you to stop all fluids. This is wrong. Basically, rehydration is essential for diarrhea. So let's get it right first. The very important that when you have a diarrhea, rehydration is essential. But the type of dehydration you take is important itself. Another means is actually antibiotics cure all. Actually, this is also false because most of the diarrhea are not cannot be dealt with antibiotics. Only the bacteria types of diarrhea are actually can be dealt with antibiotics. In fact, you will know that you will see that down in my presentation further, you'll see that most of the actual remedies are not based on antibiotics at all. Now, the third means avoid food completely. This is also false. While you have diarrhea, your body will lose fluid and nutrients, but you still need to take intake. So therefore, small frequent meals are usually encouraged, and you will learn how to actually handle meal, take the meal and choose the right types of meal to take during when you are having diarrhea. Okay, let's look at some of the global impact of diarrhea. So the reality is that, as I mentioned, most of the case of diarrhea for adults are self-limiting. They are not of concern. But for the children itself, actually diarrhea is the 3rd leading cause of death in children under 5. So it's a very serious concern for children. And it contributes to malnutrition and dehydration. And it's the leading cause of malnutrition in children under 5 years old. You can see from here that the cause of child mortality itself, apart from pneumonia, actually diarrhea is actually the 2nd highest mortality rate of children. So therefore, it's actually diarrhea for children is a very dangerous event. Okay, what are the causes of diarrhea? Broadly, you can see from here that actually the causes of diarrhea, we can actually divide it in 2 groups. One is infectious origin, and the others is actually non-infectious. So infectious diarrhea can be caused by virus, can be caused by bacteria, can be caused by parasite. And these are generally the common example of infectious diarrhea. Non-infectious diarrhea are basically can be caused by inflammatory diseases like ulcerative colitis itself, and or disorder of gout-brain interaction, which is actually the common known diarrhea that we call it functional diarrhea. Then the non-infectious diarrhea can be due to our food intolerance. We will talk about lactose intolerance. We will talk about celiac disease later. But diarrhea can be also caused by medication side effects. So therefore, the medication that you take itself will cause the gout dysbiosis, which means that the bacteria overgrow in the gut. At the same time, also can cause bile acid malabsorption, resulting in diarrhea itself. And also, of course, our endocrine and metabolic causes like hyperthyroidism and diabetic patient also can actually have symptoms of diarrhea. Okay, now let's look at the causes of diarrhea. There's actually acute diarrhea. So when we talk about diarrhea, basically you want to make sure that we identify whether it's acute or chronic. Acute diarrhea itself, the causes are mainly infectious origin. You can see from here, viral infection like rotavirus and norovirus itself actually account for about 30 to 50% of unvaccinated population diarrhea. Bacteria like E. coli, Shigella account for 20 to 40% of moderate severe episode. And most of the bacteria diarrhea are actually food origin. So we will talk about food poisoning shortly. Okay. Then we have diarrhea that caused by parasitic, and we also have diarrhea that caused by chemicals and toxin in organic itself. Now in here, we want to let you know that actually food poisoning is a foodborne disease itself. So one of the actually symptoms of a foodborne disease generally is also diarrhea itself. So food poisoning is the most common cause of acute diarrhea. Okay, now let's look at food poisoning, and in some of the means relating to food poisoning. Most of us think that your last meal is the one that you eat that make you sick when you got food poisoning. While this is not always the case, some bacteria take much longer to multiply and show their effects on your body. So it can be a food that you can eat a day earlier also. So the lengthens the period, the incubation period of bacteria are not necessarily short. They can be longer, 2 to 3 days itself. Now another mean is that you can chew your food to tell if it was cooked properly. And this is not true. You should know that you cannot taste chicken to tell if it has cooked properly or not. So only temperature can tell you, and therefore the food is cooked properly or not, you have to use a thermometer. Then the third main is that the spoiled food smells and looks rotten. While that's true, you can smell and look rotten, but some food that's spoiled are still fresh looking. So therefore, this is not the sure way of just looking at the food itself. Bacteria are not visible to our eyes. Then another one is washing your hands before eating will keep you safe. While it's commonly a good practice itself, but it's not keep you safe because the food poisoning can be originated from the source of the food. The preparer itself, the food source itself can be contaminated itself. So plastic chopping boards are more hygienic compared with wooden chopping board. But there's no evidence on this itself. Basically, there's no evidence that what types of chopping board are more hygienic. But most important is that you do not use the same chopping board for cooked and raw food. Basically, this is to ensure that there's no cross-contamination. Right? So that is actually the better practice itself. There's no real difference between the plastic or wooden chopping board. Vegetarians are at low risk of food poisoning. That's not true. We all know. Vegetables and fruits are also likely to cause food poisoning. So these are the food poisoning means. So let's look at one of the most common causes of acute diarrhea. And this is actually what we commonly known as norovirus, which is the stomach flu. Stomach flu actually is the leading cause of acute diarrhea globally. And for children, it's actually it's a very dangerous disease. And I want to highlight that because among acute diarrhea, I will highlight only these types of infectious origin itself, right? The symptoms are diarrhea, vomiting, nausea, and stomach pain. So it's not just diarrhea alone. Very often the symptoms have vomiting, nausea, and stomach pain come together. Now, this is very important to get treatment. The problem is that this is a virus infection diarrhea. right? And therefore, there's no approved treatment for the norovirus. So, and it's because it's a virus, the transmission is also highly contagious itself. So therefore, the only way to prevent this stomach flu actually is that when you have it, you have to make sure that you do not isolate yourself and do not have contact with others itself. You have to wait till your symptoms are gone before you can actually start touching on preparing food for others. Now, if possible, do not share bathroom with others. Wash hand often, or at least 20 seconds with soap and water. And if you have any vomit or diarrhea, clean it up. Clean it up and use what I call disinfectant to clean it up itself. So the only way you can prevent this stomach flu is actually prevent it from spreading, from contacting it, is keep your personal hygiene clean. Now, for acute diarrhea, so there are 4 standard phases of home management. Most of us, when you have diarrhea, you manage ourselves. So it's important for us to understand that whenever you deal with diarrhea, you really have to understand that how to deal with it properly. So this is not something that I think allow us to think that now diarrhea means that it can go away by itself. First, there are 4 steps that I will recommend. First is to know how to actually immediately rehydrate yourself. We call it oral rehydration therapy. The second step is that actually know what are the food to eat. The third actually is that you must learn how to screen for red flags that is actually need medical attention instead of self-management. And the fourth is that how to choose the right over-the-counter medication for the diarrhea you have itself. So let's look at it itself. The first step of acute diarrhea management strategy actually is the rehydration strategy. Now, hydration is the single most important factor in all diarrhea. So it's very important. Unfortunately, the standard water is not sufficient because it lacks the necessary salt to be absorbed effectively during an active infection. And that's why that drinking water alone is no good. So that's why a lot of people say don't drink when you have diarrhea. Not true. But you don't drink plain, pure water. What are the preferred fluid? Oral dehydration solution is actually the cornerstone of the treatment. Now, how to prepare a home oral dehydration solution? 1 liter of water, 6 teaspoons of sugar plus half teaspoon of salt. This is a standard recommendation for actually in regions whereby they cannot get oral dehydrated salt readily. And in fact, in a poor country, in country whereby they are lack of what I call the health support, right? Very often the healthcare provider will know how to prepare the homemade oral dehydrated salt solution. All right. So this is a formulation that you all can take in and prepare yourself, right? Alternative that is coconut water, right? You can also actually take sport drink. Now, for those who are diabetic, then you probably should not choose the sweet sport drink itself. But sport drink have all the minerals that you need. So sport drink is a good alternative oral rehydrating fluid as well. And of course, you can drink broths and clean soup, chicken broths and vegetable broths and so on. Now, when to take is also very important. 1-for-1 rule. Drink at least 1 cup of oral rehydrated solution for every loose bowel movement you have. Right? That is the standard guideline. That means whenever you have a bowel movement, drink 1 cup of the solution. Drink 1 cup of water, drink 1 cup of coconut water or whatever. 1-for-1 rule. Remember that when you are having acute diarrhea. Now, what are the food that you can eat itself? So try to resume appropriate eating as soon as possible, usually between half a day to 1 day. Between 1 day, you can try to eat something already. So what are the things that you can eat itself? First of all, a strict bread diet for the first 2 days itself. Basically, what are the bread diet? Bread diet basically are porridge, banana, toast, apple crust. So therefore, these are actually the recommended diet for first 2 days itself. Then after that itself, you might able to choose to take some what I call low-fat protein like fish, tofu, cooked eggs itself. You can also take digestible fruits and vegetables like carrot, pumpkin, banana. All right. You can take probiotic food, yogurt, miso, soap, And also, of course, you can take rice porridge, oatmeal, and crackers. So these are suitable diet for people who are undergoing acute diarrhea. Now, what are the food you should avoid when you're having acute diarrhea? Spicy food, fried and fatty food, sugary food and beverages, high fiber food. This is something that I want to highlight a bit. A lot of people think that the high fiber food is usually healthy, but it's not suitable for people who are having diarrhea. So avoid high fiber food. Dairy product should be avoided during the diarrhea period, and also caffeinated drinks like coffee, tea, and alcohol. Okay. Now, the third phase is that to determine whether the diarrhea needs to have medical attention. Now, this is important. So the basic knowledge of this itself, whoever have diarrhea, if you need to consult a doctor immediately if you experience 10 or more bowel movement in a day. That means if your diarrhea is so intense that you have more than 10 bowel movement a day, or you have persisting symptom that diarrhea doesn't getting better after 2 days of diarrhea. So these are the first sign that you should seek medical attention. Do not self-treat. Other than that, other warning signs are actually bloody or black stool, severe dehydration. This is particularly important because when you have people that having sunken eyes, dizziness itself, although that you might have other things, that is also show sign that because the person might not be hydrating enough. That means they did not drink enough fluid during the diarrhea. And when you lost enough water in there, you have a symptom of sunken eyes itself. So particularly for older people, it's very difficult to distinguish between old people's eye and as well as a sunken eye. So you need to be more careful for older people essentially on this symptom. Acute abdominal pain and a high fever. So any of these symptoms itself, I think will require immediate doctor attention. Don't self-treat. All right. Then what are the OTC pharmacological management, what they call option we have? That means what are medicine we can choose to take itself. So in here, I list 4 very common off-the-shelf option. First, obviously, is actually anti-motility, which is actually the doctors commonly prescribe medication to you. The main mechanism of this medicine actually is to slow down the gut movement to allow the water reabsorption. Basically, it's slowing down. So therefore, the speed of this medication action is very fast. Usually within an hour, you will see the effect. But it's not suitable for bloody stool or fever cases, people with fever. So this is very important to understand that there is a concern that if you have a bloody stool or you are having fever, then you should not actually take the anti-motility medicine. Now, they are very common and very often I think there's a safer option for it itself that if you have a diarrhea, you actually can use absorbent. Absorbent, a good absorbent is active charcoal. Active charcoal, the speed of action is quite fast, 1 to 2 hours. And basically the mechanism of it is that it binds toxin irritants. So it's very effective for active charcoal for toxin, food poisoning in terms of chemical poisoning, and so on. But also actually the charcoal can absorb bacteria. So it actually can help in relieve the symptom itself. So, but then when you are taking active charcoal, be careful because active charcoal, because it's a very powerful absorbent, it can interfere with other medication that you take itself. So you need to space it or you need to be careful about combining with any medication. Then there's a very common TCM medication we call po chai pill. For those who are familiar, you know that is very common in the olden days. Whenever you have a problem, you take the po chai pills itself. The mechanism are not clear, but we know that you actually, because of the formulation, you actually have multiple mechanisms itself. But the speed of action also, the po chai pill are normally not fast. It actually takes between a day. Between a day after taking a po chai pill, you see the effects itself. But po chai pill are not suitable for intestinal infection disease. That means that if you identify that your diarrhea is caused by infection diseases itself, by bacteria or virus itself, po chai pill might not be very effective itself. Okay. Then of course, then you have a common thing that some of people say diarrhea, you take probiotic. But reality is that probiotic are not so much suitable for acute diarrhea because of its speed of action is days to weeks to effect. Right. So I will not talk about it as a antidote or immediate medication used for acute diarrhea. Probiotic is often used, very effective, in fact, for chronic diarrhea itself. So this option for acute diarrhea normally are not suitable, not effective compared with absorbent, the active charcoal, or the post-active itself. Now, as to the means that you should take antibiotic when you have diarrhea, that's not true. In fact, you can see from here that antibiotics are not recommended for most acute diarrhea cases because most of the acute diarrhea infection origin are not bacterial factors. So it's only applicable for when you confirm that the diarrhea is caused by bacteria, then only antibiotic is effective itself. So generally, antibiotics are not used for acute diarrhea unless we identify that the cause is actually due to bacteria origin. All right, what is the practical self-care measure? Rest at home, avoid strenuous activities until your stools are improving hydration is adequate. Rest. Practice strict hand hygiene. We all know. Keep yourself clean and dry, clean. And then stay off work of handling food, caring for vulnerable. As I mentioned, for acute diarrhea, there's three groups of population that you need to pay attention because that can be life-threatening. So the first one is children. So when you have diarrhea for children, you don't really want to consider self-treat, go and see a doctor. Regardless, see a doctor. Same thing for elderly. Elderly, when you have a diarrhea, is also equally dangerous, and the complication can come very fast itself. So you need to monitor the hydration closely. As I mentioned, it's very challenging to differentiate between old people's face with sunken eyeball itself. But very often that is the first sign of hydration, and the complication can come around upbreak. So very important to monitor for old people whenever they have a diarrhea. And of course, for those who are immunocompromised itself. So this is the end of my session. I pass back the time to Pauline.